Okay, good afternoon, everyone. We appreciate you joining us today. We have Dr. Adrian Baddar here, who is one of our fellowship-trained hip and knee surgeons at Hampton Roads Orthopedics. And May is National Arthritis Month, and so we are going to be discussing arthritis of the hip today with Dr. Baddar. So thank you for joining us. The first question we have is, what is hip arthritis?
All right, well, thanks everyone for joining us. So we're talking about hip arthritis and what it is. So in all of our joints, at the end of the bone, we typically have cartilage on the end of the bones that articulates against the other side of the joint, which has cartilage on the end of the bone. That makes a nice, smooth, frictionless, painless surface. Unfortunately, though, cartilage has no ability to regenerate, repair itself, heal itself. So as we go through life, it can only wear out. As that cartilage wears out, then the bone starts to eventually articulate against the other end of the bone. And that is what we mean by arthritis. The term arthritis itself just means joint inflammation, but colloquially it's come to mean the wear and tear of that joint where that cartilage is wearing out and the bone's taking up the stress, and you get a painful joint from that wearing out process.
Great. Is all arthritis the same?
So all arthritis is not the same. The most common form of arthritis is what we call osteoarthritis. That just simply means wear and tear arthritis, again, where that cartilage surface is worn out just from use or overuse or from certain types of injuries. But there are certain processes within our body that can damage cartilage. So obviously an injury can damage body. There are diseases that can damage cartilage. Rheumatoid arthritis, of course, is one that's well known. That is actually an autoimmune disorder. That's where your own immune system gets fooled and thinks that cartilage is the enemy all of a sudden. Usually it's triggered by a virus, and now your own immune system starts attacking cartilage and eating and destroying that cartilage and wearing it out. There's several other autoimmune processes that can do the same thing. Lupus, psoriatic arthritis, all of those can do that. In the case of a hip may not form properly. That's one of the checks they do on babies when they're born to see if their hip is out of socket or if they're having an issue. If the joint doesn't form properly, then you can see abnormal stresses on it. That can lead to early wear and tear. You can get infections in joints while they're very rare. That could destroy a joint from your own body trying to fight off that infection. And then there are even crazier disorders. One of the ones we see not fairly infrequently is a process called avascular necrosis, where the blood supply coming up into the ball that makes up the hip joint actually gets choked off. And so the ball loses its blood supply and dies. And so the bone underneath the cartilage can collapse, and you basically end up with a square peg in a round hole. And of course, that's not very good for the cartilage on top of it, and that can destroy the cartilage. So there's a lot of processes that can do it. The most common thing, though, wear and tear arthritis, just, it just wore out.
Great. What are the risk factors for arthritis of the hip?
So there are lots of things that put us at risk for wearing out that cartilage. The most common cause is our size. So being overweight puts more stress on cartilage. For all of us, cartilage has the same mechanical properties. And so increasing the stress on it by our weight will put more stress on it. Certain activities obviously can do that. Interestingly, a lot of people think of running and jumping types of activities as stressful, but we've actually never proven that running and jumping type activities are bad for your hip joints. So that's not known for sure. Okay, but obviously injuries, if you were to dislocate your hip in a car accident, if you're having a fracture of your hip, obviously those can be risk factors. Healthy living, healthy diet, all of that is important to maintain your cartilage and your health. Avoiding, there are like activities like working in a crouched position for long periods of time. Those can put stress on your joints, and so obviously those aren't too good. Heavy weight exercise is obviously not too good. Moderation, as always, is the key to life.
Key to life, okay. If someone has hip arthritis or they think they have it, what kind of symptoms may they experience?
Yeah, this is where it gets really tricky, because the symptoms for hip arthritis are not all the same for everybody. In fact, a lot of people don't even recognize that their hip is the problem. Most people associate their hips on the side, and so they think that pain on the side is where their hip joints are. That's actually pretty rare to get pain on the sides. It's possible, but that's not common. Usually that's more from a bursitis, from where the muscles or tendons rub over the side, getting too tight or too inflamed, and so that's usually a bursitis problem. Hip arthritis is usually in the front of your hip, in the groin area, and people tend to associate that more with their pelvis or some other kind of issue, and not with their hip joint. But that is the most classic place to feel it, is in their groin. People will have trouble putting on socks and shoes, so that twisting type motion, that is your hip that is twisting with those kind of activities. Those will become difficult and painful. The pain can be found in your buttock, though. Okay, and then that gets even more tricky, because that's a common place for back pain to refer to. And so when people just have buttock pain, you have to differentiate that between, is it the hip, is it the back, and sometimes that can be a little tricky. And then even crazier than that, some people won't even get any pain around their hip. It will all just be felt around their knee. I kind of describe this as like when people have heart attacks and they feel the pain in their jaw, in their left arm. It's nothing near where their heart is. So the same thing can be with your hip. You can have very bad hip arthritis and only feel it down at your knee. And so you don't want to make a mistake and be treating someone's knee when all their pain is really coming from their hip. So you want to do a good evaluation to make sure you figure that out. But the symptoms typically, again, in the groin, can be on the sides, can be in the buttock though, and can just be down at the knee. So any kind of pains in those areas, you do want to get them evaluated, figure out what's the source of that.
So great lead into the next question. How is hip arthritis diagnosed? What do you do?
Yeah, so I mean, to figure it out, of course, you want to do a proper examination and history, and figure out what's going on. The easy answer, of course, from an orthopedic standpoint, is we would get an X-ray to see. We can very well assess on just a simple X-ray how the joint space looks, how the bone looks. As our bodies develop arthritis in any joint, our body is smart. Our body's trying to deal with it as best it can. Of course, it's very limited. It cannot repair cartilage. It cannot regenerate cartilage, so that option is taken away from our bodies. But our body does recognize that it can try to spread the forces over a larger area, so it will try to make the joint a little bit bigger. How does it do that? It lays down bone spurs. Those do two things. One, they're trying to spread the forces out. The other thing those bone spurs are doing, though, is robbing you of motion, so that they're going to make your joint a little bit stiffer. But your body knows that if the joint doesn't move, it won't hurt. Okay, and so we'll be able to see those bone spurs on X-ray. We'll be able to see that narrowing of that cartilage space on X-ray. So a lot of times the X-rays are pretty definitive. You can pretty much make that diagnosis. Now there are some of those subtle early processes that we may not pick on. That I was talking about, that avascular necrosis where the ball is dying. Early stages of that will not show up on an X-ray. You would need to do an MRI to catch something like that. And there are some subtle things that MRIs would show better than an X-ray. But most of the time an X-ray is good enough. Obviously the physical exam, very important. Again, the key to that is evaluating that twisting motion. If that's the source of pain, twisting your leg in as if you were going to tie your shoe or sock or put your sock on, those kind of causes of pain, you're going to be really suspicious of the hip joint as the source.
Mm-hmm. And if someone comes to see you and you diagnose them with hip arthritis, or they have severe hip arthritis, what treatment options are available for those patients?
So that's a good question. What can we do for arthritis? There's a lot of different options early on. One, obviously, making sure that people understand a healthy lifestyle, healthy body size, keeping the weight off is very important. Even getting weight off can take so much stress off your joints, and that can help tremendously, so it doesn't, it's not as painful. We want to make sure, again, nutritionally, that your nutritional status is good. The most important thing, one thing we're seeing commonly now is the level of your vitamin D. Vitamin D deficiencies can make you more prone to develop arthritis and can make the pain from arthritis more significant. So by correcting a vitamin D deficiency, you can slow down the rate of arthritis and you can lessen that pain. So that's a key thing too. Anti-inflammatories and Tylenol type of medications are typically a first line to help with the symptoms. Obviously these are pain medications that work just mildly. They help with the mild aches and pains. But that's a first line treatment. Anti-inflammatories, we're talking about medications like Advil or Aleve. There are a multitude, there's about 30 different anti-inflammatories that are available. Only Advil and Aleve are available over the counter. All the rest are prescription, so it would mean going to see a doctor to get those prescribed. And a lot of times we can find one that works very well for patients. Physical therapy can help to work on regaining motion and strength, so that can be an important modality. We can be more aggressive at calming it down. Unfortunately, a lot of people don't like this, but you can do cortisone injections into a hip joint just like we do them commonly in knees and shoulders. Cortisone is a steroid that you can put into a joint. We're using it as an anti-inflammatory. It's a very potent way of doing it. One, you're putting the medicine right where you need it, right into the joint you need. So you're getting a very focal delivery, which is great. You can put in a very strong dose, and so that can work and provide very long-lasting benefits. I mean, a single injection can last close to a year in some people. Again, it depends on the person. It depends on how bad their arthritis is. You know, you can safely repeat those injections 3 or 4 times a year. You don't want to do it more frequently than that. There is a concern that you could hasten the arthritis, although that's more of a theoretical concern than a proven concern. But that can be very worthwhile, very beneficial to people, especially if they're having a really bad flare that they're trying to get through. That can also be used for diagnostic purposes. If we're having a hard time, is the pain more from their back? Is it more from their hip? Where do we need to focus our attention? When we do that injection, a lot of times we'll put in a numbing medicine, and so that will make just the inside of the hip go numb. And so if during that period of time it takes away, say, 90% of their pain, then we know 90% of the pain is coming from the hip and the other 10% is coming from elsewhere. And so that can be a nice way to really delineate and define where the pain is, what's the source. If it's the other way around, if it relieves only 10% of pain, then the hip's not a big part of it. So that can be a really nice modality. Obviously, the be-all and end-all, if a hip is completely worn out from the arthritis, if all the other things we've tried have not worked and we've run out of conservative modalities, then the final option would be to consider a hip replacement. Okay, and actually replace the joint.
Great. Is there any way to prevent arthritis at all?
So the number one thing, again, maintain a healthy lifestyle, keep the weight down. Being heavy has been shown to be the biggest stressor on our joints, and so that's the one thing I can't stress enough to people. Stay healthy, stay active. You don't actually, some people think that by using their joints less, they'll preserve them more. That's actually not true. Joints react to activity. It's good for them to move the fluid around the cartilage. Cartilage gets its nutrition from that joint fluid, so you do want to maintain your lifestyle and your activity level, but keep that weight down more than anything at all, and stay active. I mean, those are the best options. Obviously, avoid major traumas. If people have, issues with the way their hip joints form when they were a baby, I mean, there's only so much you can do for that. There are some surgical options to correct that. Usually that's going to be pursued at a younger age to try and preserve the joint. But it's mostly about lifestyle.
Great. Well, thank you all for joining us today. Like I said, it's National Arthritis Month, May, so we'll be doing these lecture series every week. So join us next week. And Dr. Adrian Baddar, thank you for your time. We appreciate that.
Thank you.